Mental illness awareness has been high in 2017 as people open up about their personal battles. There has been so much progress, but we still have a far way to go. There's still a stigma surrounding different types of illnesses and a long way to go in understanding them. Out of all the mental illnesses, personality disorders are the least talked about. Most people think of those who suffer from a personality disorder as crazy or dangerous. Today we will be shedding light on one personality disorder in particular. BPD, or borderline personality disorder, is a personality disorder marked by unstable and inconsistent moods, behavior, and functioning. This often results in unstable relationships, impulsivity, anger, depression, and anxiety. BPD is a personality disorder where you feel as though you lack control, creating frustration. It is thought to be triggered by a traumatic event in early childhood, though there is no direct correlation. Researchers believe that those with BPD, due to the possible traumatic event, experience different structural changes in the part of the brain that controls emotions and impulses. However, it should be noted that this shows up in people who do not have BPD, which makes BPD even more mysterious and unknown. BPD can be hard to detect as it so often overlaps with other mental illnesses. One might talk about depression, but not talk about or be aware of their other symptoms. This results in one being wrongfully diagnosed with depression and not BPD. The list of symptoms of BPD includes frantic efforts to avoid real or imagined abandonment, a pattern of intense and unstable relationships with family, friends, and loved ones, often swinging from extreme closeness and love or idealization to extreme dislike or anger or devaluation, distorted and unstable self-image or sense of self, impulsive and often dangerous behaviors such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. Reoccurring suicidal behaviors or threats, or self-harming behavior, intense and highly changeable moods, chronic feelings of emptiness, inappropriate and intense anger or problems controlling anger, stress-related paranoid thoughts, severe dissociative symptoms such as feeling cut off from oneself, observing oneself from outside the body, or losing touch with reality. Interpersonal relationships are quite difficult, but DBT, or dialectical behavior therapy, can offer skills to not only cope with, but successfully live with BPD. Since its creation, DBT has been used to help not only BPD, but other mental illnesses as well. Borderline personality disorder is a personality disorder not much spoken about, as many are afraid of it. But it is important to remember that those with BPD are still people, and deserve to be heard and loved. Remember to subscribe for more facts on personality disorders. Thank you for watching Psych2Go.
The term borderline was first introduced in the United States in 1938. It was a term used by early psychiatrists to describe people who were thought to be on the border between diagnoses, mostly psychosis and neurosis. In the 1970s, a deeper understanding of borderline personality disorder began to emerge. People with BPD were described as very emotional, needy, difficult, at risk for suicide, and have an overall unstable level of functioning. In 1980, BPD became an official personality disorder in the Diagnostic and Statistical Manual of Mental Disorders, or DSM.
Symptoms of borderline include a recurring pattern of instability in relationships, efforts to avoid abandonment, identity disturbance, impulsivity, emotional instability, and chronic feelings of emptiness, among other symptoms. Borderline personality disorders occurs in most people by early adulthood, by the early 20s. A person with this condition will have experienced an unstable pattern of interacting with others for years. This pattern of behavior is usually closely related to the person's self-image and early social interactions with friends and family. The behavior pattern is present in a variety of settings, not just at work or home, and often is accompanied by a similar lability, fluctuating back and forth, sometimes in a quick manner, of a person's emotions and feelings.
People with borderline personality disorder are usually more sensitive than most people to environmental circumstances. The perception of impending separation or rejection, or the loss of external structure, can lead to profound changes in self-image, affect, cognition, and behavior. Frantic efforts to avoid abandonment, whether the abandonment is real or imagined, of unstable and intense interpersonal relationships, characterized by alternating between extremes of idealization and devaluation. Identity disturbance, such as a significance and persistent, unstable self-image or sense of self. Emotional instability due to significant reactivity of mood. Example, intense episodic. There's also emotional instability due to significant reactivity of mood or chronic feelings of emptiness. There's also inappropriate, intense anger or difficulty controlling anger.
Causes are unknown, but genetic, family, and social factors are thought to play a role. Risk factors include either real or fear of abandonment in childhood or adolescence, disrupted family life, poor communication in the family, sexual, physical, or emotional abuse, and it occurs equally in men and women.
Day-to-day life with this disorder includes issues with relationships and work. Borderline personality disorder can have a major impact on your relationships. In fact, having difficulties in relationships is one of the primary symptoms of BPD. People with BPD can have many arguments and conflicts with loved ones, or a lot of relationships that repeatedly break up. The way that you feel about your family, friends, or partners can change dramatically from day to day or hour to hour. These patterns can be very difficult for both a person with BPD and those who care about him or her. In the work life, since BPD has such an impact on relationships, people with BPD may find themselves in trouble with coworkers, bosses, teachers, and other authority figures. The intense emotional changes may also impact work or school. You may have to be absent more often. Also, it includes issues with concentration.
Around 4 to 6 million suffer with this disorder in the United States.
One therapy used to treat borderline personality disorder is dialectical behavioral therapy. This treatment was originally developed to help chronically suicidal individuals. DBT combines crisis intervention support with other intervention practices that are theoretically grounded in Eastern meditative and acceptance-based philosophies. Research conducted on this treatment have shown it to be more effective than other psychotherapeutic and medical approaches to helping a person to better cope with this disorder. DBT focuses on helping the client build skills in acceptance and tolerance of intense negative emotions as a means to take better control of their lives, their emotions, and themselves. In DBT, the therapist and client are expected to build a relationship where the therapist can help the client start to bridge the gap between emotional and rational interpretations of their world. In addition, client and therapist exchanges help the client negotiate a balance between acceptance and change of certain client tendencies, hence the term dialectical. The client must give the therapist permission to question or identify in a moderately non-confrontational The client must give the therapist permission to question or identify in a moderately non-confrontational manner distorted interpretations or inappropriate reactions the client may display over the course of therapy that are based on emotional reactivity rather than rational processing. It is a comprehensive approach that is most often conducted within a group setting. Because the skill set is learned in a new and complex, it is not an appropriate therapy for those who may have difficulty learning new concepts.
Another form of therapy is psychodynamic psychotherapy. Psychodynamic psychotherapy is usually an ongoing process which rarely lasts less than 12 months and can often last longer. Psychodynamic psychotherapy allows the client to talk through any issues that they have in their lives. The therapist can then help the client to understand their behavior and their way of thinking and link it to their past. Therapeutic relationships provide an opportunity to resolve past issues and conflicts, but this can be a long and difficult process. In psychodynamic psychotherapy, communication can be difficult as people with borderline personality disorder usually have underdeveloped interpersonal skills, which is one of the characteristics of this disorder.
Cognitive behavioral therapy is a combination of two psychotherapy techniques, cognitive therapy and behavior therapy. The aim of behavior therapy is to enable the client to change how they react to certain stimuli and thoughts. If there is a connection between a triggering incident and a behavior and or emotion, this type of therapy attempts to weaken the connection so new, more rational and positive behaviors can develop. Cognitive behavioral therapy then attempts to determine what needs to change in the life of the client to improve their behavior symptoms. It is more focused on improving the client's here and now than delving too deeply into the past, since the past cannot be erased.
Another form of therapy is cognitive analytic therapy. This therapy consists of a 24-week session program. It integrates theories from several different theoretical models, including cognitive therapy, cognitive behavior therapy, psychoanalysis, and object relations theory. It involves both the therapist and client actively working together to identify current problems of thought, feeling, and or behavior, and linking these things with past events in the client's life. This type of therapy especially looks at interpersonal issues and uses the therapeutic relationship as a means of identifying and changing unhelpful patterns of relating to self and others. These patterns are identified as procedures, and the therapist and client together work out exits from these patterns together.